Hi, my name is Jamal Saleh. I am a fourth-year medical student from St. Christopher Medical College. I'm doing a psychiatry rotation with Dr. Danny Martinez. This presentation will discuss the psychiatric evaluation. Psychiatric evaluations are meetings between a psychiatrist and a child, adolescent, or adult patient, where the psychiatrist tries to collect as much information to diagnose an emotional behavior or developmental disorder. The major feature of a psychiatric evaluation is, of course, the one or more face-to-face interviews that the psychiatrist conducts with the patient, where open-ended and diagnosis-specific questions are asked to elicit answers that are relevant to diagnosing a mental health condition. The goal is to learn more about the patient's current problems and symptoms, as well as their personal and family psychiatric and medical histories. In addition to the interview, a physical examination may be performed along with other diagnostic testing that may help in the diagnosis. Some important notes that I'll interject through this presentation. In particular, psychiatrists, when doing an evaluation, must always be cognizant to rule out if the presenting symptoms are attributable to one of four things. Number one, is it a general medical condition? Number two, is the patient under the influence of substances? Number three, is the patient significantly impaired functionally by the symptoms? And number four, do the symptoms meet criteria to be given a psychiatric diagnosis? All four of these have to be met before a psychiatric diagnosis is made. Dr. Martinez specifically also during his evaluations will always consider the biopsychosocial, cultural, and spiritual considerations that play a role in the presenting symptoms of a patient, as these can vary, in particular how they impact the patient from culture to culture and different religious views. The purpose and conduct of a psychiatric evaluation depends on who's requesting the evaluation, why it's being requested, and what the expected role of the psychiatrist is in the future role of the patient. Three types of clinical psychiatric evaluations are done. The first one is a general psychiatric evaluation. The second one is an emergency evaluation. And the third type of evaluation is a clinical consultation, where another member of the medical team will request that the psychiatrist evaluate the patient for consideration of a diagnosis. I'll briefly just discuss what each of them are. A general evaluation is intended to collect enough data about the patient to develop initial psychiatric diagnosis, initial treatment plan. In some cases, the evaluation is a reassessment of new information that's gathered and an alteration to the treatment plan that's already in place. Again, this could be one or more face-to-face interviews by a psychiatrist or other professional. During the interview, the patient provides information about their condition, telling their own stories about their symptoms in their own words. The second type that we mentioned was the emergency evaluation. Here, it's a little bit different. The psychiatrist tries to assess the thoughts or feelings that the patient is experiencing are the reason why they are intolerable and requiring this emergency status, and whether the patient displays any harmful behavior to themselves or others. During this evaluation, of course, the psychiatrist tries to determine what is causing the emergency and identify diagnostic possibilities quickly. Emergency evaluations tend to be shorter in length, but are usually brief and symptom-specific. In general, patients will not be hospitalized, require longer emergency evaluations than those who will receive follow-up assessment. The third type that we discussed was the psychiatric consultation, and this is an assessment requested by another healthcare professional. In some cases, these are comprehensive. In other cases, it's a little bit more narrow. An example of a narrow consultation would be to consider changing medication for a certain diagnosis that's already in place that the patient's being treated for. A little bit about inpatient versus outpatient evaluations. Psychiatric evaluations that are performed inpatient have their advantages because they tend to be more intense, they're more frequent, and the clinician has access to laboratory services around the clock. They also typically involve numerous healthcare professionals and health professionals from other fields. In addition, the psychiatrist can closely monitor the patient during the inpatient setting. Can you pause it?